Okay, treatment of the extensors of the hand and wrist. We covered just a few in our notes: extensor carpi radialis longus, brevis, extensor carpi ulnaris, brachioradialis. But typically we're going to treat them all as a group anyways. So warming up, easy place to do some gentle compression. Treatments or trigger points in the extensors are the second most common in the human body, following the upper trapezius. And here we've got a few different options for palpation. If you can slide over to the other side of the table a little bit. If you get their arm abducted slightly, elbow flexed, and then a pillow under the arm to support, helps put them in a more neutral position for palpation. So we can either cross fiber palpate through that whole group, being aware that anyone that works with their arms will have ropey, or with their arms or their hands will have ropey feeling muscles in this area, and that's normal. Or we can use again our pincer palpation, which is very effective here. So rolling through, looking for any nodular areas. How does this feel here?
Tender.
Tender. Can you give me a number, 0 to 10?
5.
5, okay. Take some nice easy breaths. Holding until that pain decreases. Okay, to reset, we're just going to bring them through some extension. Actually, because it's easy, bring their hand right off the edge of the table, so you can bring them into full flexion and all the way up into extension. 1, 2, 3. And if you could do that 3 times for me, please. Great. And to stretch, we're going to bring them into flexion with either slight radial deviation if you're focusing on the ulnaris, or slight ulnar deviation if you're focusing on the radialis. And getting them to gently push the back of their hand into your hand for 5, 4, 3, 2, 1, and relax. Increasing the stretch 2 or 3 repetitions, holding for 30 seconds at least at the end. Nice one to focus into brachioradialis. Make sure the elbow is extended. Grasp the wrist just above the thumb here, and grasp the tissue around, not just the bone. And do like a fascial pull, and then bring them into that ulnar deviation, and they'll often feel a strong fascial stretch all up through here. If you wanted to do any kind of active treatment in through here, pinning, and then either moving them passively through that flexion and extension, or getting them to passively move, or actively move, sorry, through those ranges, nice and slow. If you're focusing into any of the extensor digitorum or any of the muscles that are acting on the fingers, making sure that they're, as they're bringing their hand down, they're curling their fingers and making a fist as well to further lengthen. And reaching up and spreading the fingers, and back down and curling the fingers and making a fist. Right. Attachment release. I'm just going to show you here for one off of the epicondyle. So we're going to sink in onto that attachment. Longitudinally friction and cross fiber friction. And most of these muscles have very specific tendinous insertions onto the carpals. So again, like we talked about, probably not very comfortable to friction right over those bony prominences. So sliding up that muscle until you can palpate the musculotendinous junction and choosing to do your frictions in that area. And the area of frictioning is going to depend on which muscle you're biasing, which if you know the origin and insertion should be no problem to figure out. Approximation for these muscles. So finding your tender point. And to control the hand, if you interlock the fingers, do a nice grip, bringing them into wrist extension and typically elbow flexion, even for the ones that don't cross the elbow. But palpate, because at some point, like if I'm in neutral here, I feel them relaxing. But as I get to that full extension, I feel them kicking on a little bit again. So backing off, finding that position of most relief for your patient. And with this hand grip, then you can experiment. You can add radial deviation easily, ulnar deviation easily, and then different levels of pronation and supination. It's a very effective grip to control the hand. In the notes, they have very specific referral patterns for the different extensors, but a lot of them overlap. So in general, the extensors will refer into the thumb, into the volar aspect of the wrist, and the extensor digitorum will refer into the fingers, depending on which fibers you're contacting. It'll be the fibers that are controlling the different fingers that it will refer into.